Well, let's get to the COVID data first. And India has reported 28,204 new cases in the last 24 hours. That's the lowest in 147 days. India's active caseload is currently at 3.88 crore, the lowest in 139 days. In fact, the active caseload, I beg your pardon, is 3,88,508. That's the lowest in 139 days. Active cases constitute 1.21% of total cases, the lowest since March 2020. The country also reported 373 deaths over the last 24 hours, taking the cumulative death count to 4,28,628. But let's just take a look at this phenomena that we've observed every Tuesday. There's always a dip in cases, and this is because over the weekend the testing is a lot less. So if you take a look, those are the Tuesdays in the last couple of weeks, and every Tuesday, like on 10th of August, today that is 28,204 cases. 3rd of August, it was 30,549. 27th July, it was 29,689. And 20th of July, it was 30,093. So we have seen this dip in cases on Tuesdays. Well, let's now take a look at India's vaccination equation, and that is a big worry. On Monday, India reported just 16 lakh jabs given in the previous 24 hours. So that's carrying over from Sunday. But we need to be vaccinating at least 1 crore a day, or 10 million, if we're to vaccinate at least 60% of the population by December. So far, about 8%, just about 8% of the population has been vaccinated with 2 doses of the vaccine. Well, let's now take a look at Kerala. And Kerala on Monday reported 13,049 fresh COVID cases. That's the highest for any state, pushing the total infection caseload there to 35.65 lakh, with the number of people dying due to the virus rising to 17,852 after 105 more deaths. The Kerala government is now pushing a mass inoculation drive across the state from this week in view of the high number of COVID cases. The drive will go on till the end of August, according to what the Chief Minister said. Well, to talk more about the situation in Kerala, that is one of the worst affected states, and of course we have Maharashtra, which has been in the past one of the worst affected states. We're now joined by Dr. Rajiv Jayadevan, Deputy Medical Director, Sunrise Group of Hospitals, Kochi, and past President, India Medical Association. And we're also joined by Dr. Chandrasekhar, Chief Intensivist, Fortis Hiranandani Hospital from Mumbai. Thank you so much, doctors, for joining us. And Dr. Rajiv, I'd like to start with you. And it's very, very worrying, the situation in Kerala right now, although the cases that have been reported in the last 24 hours is a little lower, but it's still significant proportion of the cases that have been reported across the country. And if we look at Kerala, what's worrying is that you have the festival season coming up soon, and that I know is something that's worrying authorities.
Definitely. What you said about the festival worries me as well, because last year, if you look at the curve last year, Kerala's curve really never took off in the first half of the year because of all the measures that were taken. But towards the end of October, there was a significant surge, and that was incidentally the only peak that Kerala really had last year. And that was about a month after the festival. And as you might know, Onam is the harvest festival in Kerala. It's the largest festival in this part of the world. Now, I'm concerned genuinely that the number of cases will go up, and the question really is whether the healthcare system can absorb it. Even last year, the healthcare system barely broke a sweat when the number of cases went up. It did come under strain this year, though, under the Delta variant, when in May the number of cases really went up, and the government had to go in for a lockdown. But you're right. You know, there is a concern with increased activity, but the authorities are doing their best to keep the crowds under control. There have not been any mass gatherings. The hospitals are on alert. They are aware that a surge may happen. As of now, it is functioning smoothly, but there is definitely a genuine concern.
Right. And Dr. Chandrasekhar, if we talk about Maharashtra, now you've had restrictions easing. You're going to have the local trains opening up from the 15th for those who are fully vaccinated. The Chief Minister talking about how everybody has to remain alert, that it's not that the cases have gone down. Also, the health department has said there are 45 cases of the Delta plus variant reported in Maharashtra. So really, even though cases are coming down and things are sort of normalizing, but you have to remain very, very alert.
Gagi, that's absolutely correct. Even though the number of cases in Maharashtra and Mumbai are downtrending, this could be just a silence before the storm. What we can see that, especially before the second wave, even before the first wave, we have seen this trend. The cases have gone down, and again with the opening up of whole community and market and all these things. The cases have we are looking up for the third wave. We have discussed. We are anticipating for the third wave, and that too. There is a lot to be done in the community in terms of vaccination, because considering our country's population, we are in the earlier phase of the vaccination, and there are many challenges in terms of vaccination also. And before that, we are hurrying up in opening up the market and the community, and for the festivals and for the travel and all these things. And probably again we may see that preponing this third wave, what I feel.
Right, and Dr. Rajiv, again, if we come back to the Kerala, situation, there's been a lot of questions because initially the Kerala model was praised. We also know after the antibody testing was done, that Sero survey, that it was found that, only 43% of people in Kerala were infected compared to, over 60% if you look at the rest of the country. So, in fact, I spoke to experts who actually believe that, the strict measures and the lockdowns have kind of prevented the virus from, going through the people, and that's a bit of a, controversial view, but it's prevented the virus from going through most of the population. So most of your population is still hasn't had the virus yet, and because of that, you'll have to now really increase the vaccinations if you want to protect them.
Absolutely. What matters is to put shields in front of the virus. So we want people who are impenetrable to the virus, so the virus does not spread too deep into the community. And there are two ways to achieve that. The safest way, obviously, is to vaccinate, and the less safe way is to let the virus spread. So virus spread has occurred to a significant degree since the ICMR survey that was done mostly in June. And vaccination has also been significant in Kerala. Vaccine hesitancy is perhaps the lowest in the world. Everybody wants a vaccine in Kerala. And the good statistic that I have to give you is if you take the vulnerable age group, that is, or the susceptible or vulnerable age group, that's over 45, the mortality curve really takes off at the age of 45 up. I'm talking averages here. If you take the people over 45, over 80% have been covered with at least one dose of vaccine. And we know by published data that one dose of vaccine reduces hospitalization and mortality by over 90%. So if you do the math, compared to any other surge in the past, the healthcare system is unlikely to come under such severe stress. But that being said, I'll repeat what I say all the time on statistics.
Right.
A small percentage of a large number is still a large number. And our healthcare infrastructure anywhere in the world is not really geared up for a very large surge of patients. Even if you take the most developed nation in the world, it really cannot take 10,000 people coming into a town. You really cannot. Of course, there is no such system in the world. So that is something we got to keep in mind. But the good side is a good part of the population has been covered at least by one dose. And the senior segment and the vulnerable segment of the healthcare workers, frontline workers have all been well covered. The frontline workers are 100% vaccinated. Healthcare workers are 100% vaccinated with very, very rare exceptions. Those are
right.
The good statistics.
And I'd just like to go across to Dr. Chandrasekhar. What about the vaccination, coverage in Maharashtra so far? And the worry is if we take longer in vaccinating the population, that we'll see more variants emerging. We already have Delta and now Delta Plus, and hopefully we won't see any more deadly variants.
Gagi, so regarding Delta variant, actually we the Indians and Asians, primarily we have faced and we have gone through the Delta variant in the first spike or a second spike, and Delta variant is more worrisome for these European countries and American thing, and primarily this our Asian subcontinent had suffered from a Delta variant predominantly, and yes, that's why we are getting additional variant, that is a Delta Plus variant, and still it had not been a variant of a concern. But it's a variant under observation and a variant under investigation at this stage. But the coming days, how fast we are in vaccinating the people, and some more informations are coming in, and the thing availability of the vaccine, and many other vaccine companies, pharmaceutical companies, they are getting a licenses. Johnson & Johnson had got a license recently, and Sputnik had increased its supply, and its local production had also started. Now the point of the one more publication had come yesterday itself, that's from the ICMR study, and the National Institute of Virology had published that its study of mixing or cocktailing the COVID vaccines.
That of course is a preliminary study, and yes, they'll need more further studies on that. But I get your point that we do need more vaccines quickly in our kitty if we're to increase the rate of vaccinations, and that's the only way to prevent that third wave or really ensure that it's not a devastating one. Thank you so much, doctors, for joining us on the program.
Thank you.
Thank you. Well, let's now focus on the US, where coronavirus cases and hospitalizations are at a 6-month high, fueled by the rapid spread of the Delta variant across the country. Grappling with low vaccination rates, nationwide COVID cases have averaged 100,000 for 3 days in a row. Now, the surge of the disease is the strongest in some of the southern states. Hospitalizations also rose 40%, and deaths have registered an 18% uptick in the past week. Well, to talk more about the situation in the United States, we're joined by Professor Ishita Dwivedi, Cardiology, Lenox Hill Hospital, New York. Thank you so much, Doctor, for joining us in a very, very worrying situation in the US. Initially, when the vaccination drive started, the numbers seemed promising, but now you have over 100,000 cases being reported every day.
Yes, unfortunately, we are seeing a rise in the numbers. The hospitalizations have gone up by about 100% in the last few weeks. Having said that, I think it's mostly related to the Delta variant. We're seeing that most of the infections currently are related to the Delta variant and are occurring in the unvaccinated population. Having said that, about 30% of the eligible United States population still remains unvaccinated. And what we're seeing is that is mainly the cause for the increased cases, hospitalizations, and death in the United States currently.
And this surge in infections, now that you've had a chance to study it, what has it taught us about breakthrough cases, that's infections after you've been fully vaccinated?
Breakthrough vaccinations are not a surprise because the main effect of the vaccine is to prevent deadly hospitalizations, deaths, or deadly disease. What we're seeing is that the mortality rate or the rate of death in vaccinated people is less than 0.01%. But breakthrough infections are taking place in people who are vaccinated, but most of the symptoms are mild. Hospitalizations are uncommon, and it's mostly in people above the age of 65 years. So we remain hopeful that as we get more population vaccinated, the breakthrough infections and the overall hospitalization and the case rate will go down, because the virus will have less people to infect and less means to propagate through the community.
Right. And Doctor, there's such extreme levels of vaccine hesitancy, however, that's being seen in the United States. How are you countering, the misinformation that seems so widespread?
You're right. Absolutely. With the internet and, information available to everyone at our fingertips these days all over the world, there's misinformation, and that definitely leads to vaccine hesitancy. Having said that, there are mandates being put by the government. So recently, the military troops in the United States are going to be vaccinated, and I believe it's going to be mandated. A lot of healthcare organizations are mandating vaccines for their workers, or requiring weekly testing of COVID-19 by the workers who are employed by these large healthcare groups. So, the hope is that with the regulations put in place and mandates put in place and incentivizing people to get vaccines, there's places that are incentivizing people either monetarily or through other perks and privileges to get vaccinated, and hopefully that should help with increasing the vaccination rates and decreasing the vaccine hesitancy as well.
Now, talking about masks, the mask mandate has been confusing. Earlier, the CDC said it wasn't needed for the vaccinated and people removed it. There was some amount of criticism and now they're trying to bring it back, but there's pushback against it.
Yeah, unfortunately, with the pandemic, I think we've had to evolve as the disease has progressed, as the new variants have come about. I think in the summer, the hospitalizations and the death rate was at an all-time low, and CDC felt confident to perhaps get rid of some of the mask mandates, but I think nobody could have really predicted the Delta variant and how contagious it was and how deadly it would have been throughout the world. So I think in the light of new information, CDC had to place the mask mandates back, especially in areas of high transmission and areas where the vaccination rates are low. So that's what we're currently seeing right now, and I'm hoping that as more people get vaccinated, we can try to get rid of some of these mandates in the long term, but that remains to be seen.
And what is the thought on booster doses of the vaccine? Of course, there are countries around the world that haven't even got, one dose, but what is being thought there in the US currently?
So that remains to be seen. I think that booster dose is definitely something the CDC is considering very seriously. And come fall, as we start to see the flu season come back again and people are more indoors, I think it'll be under strong consideration to consider a booster dose for people, especially above a certain age and those of immunocompromised status, whether it be because you're undergoing treatment for cancer or other problems that lend your immune system to be weaker than a normal person's. But I think we need more data, we need more science, and as we see that the pandemic evolve, we'll sort of also understand how the variants are evolving and whether, given the new data in the fall, if we need a booster dose for the whole population or a subset of population that are more vulnerable.
All right. Thank you so much, Professor Ishita Dwivedi, for joining us on the program. Well, with that, time for us to slip into a short break. On the other side, frequently asked questions about vaccines and COVID. Stay with us. Now for our special campaign, Vaccinate India, in partnership with Google, where we discuss questions that many of you have about the vaccines, about COVID, questions that you often look up and Google. And to answer those questions, we have with us Dr. Rajiv Jayadevan with us. Thank you so much, Doctor, for joining us to answer those questions. And one of the questions that people are looking up a lot now, especially with the vaccine drive underway, is how long does it take to develop immunity after a COVID vaccine?
That's an excellent question. Yes, we know that full immunity takes 2 doses of the vaccines available in India at this time. There is evidence that even after 1 dose, after about 2 weeks after 1 dose, the immunity kicks in, but the full immunity kicks in only 2 weeks after the 2nd dose. And it's important that we don't get infected during the vaccination process due to the crowd factor in crowded indoor environments. Yes, that's something that I would discourage people from getting. Don't get into crowded spaces when you go to vaccinate. And in terms of how long it will last, yes, it will last for a very long time. Your protection against severe disease will perhaps last you a lifetime, and that is the estimate at this point. The protection against picking up the virus in the future, you could pick up a mild infection in the future, like in your nose or throat, but it's unlikely that you will get sick from it. So it's overall, it's a very, very good news pouring in from all around the world about all the vaccines.
That's right. And in picking up infection after the vaccine are what we call breakthrough cases, and that we're seeing that they are taking place, but people don't need to be hospitalized if they do get an infection. Usually that's the case if they get an infection after the vaccines.
Yes, people tend to get confused about what efficacy means. Efficacy is measured on different grounds, like in school. You can score very high marks in math and be not so good in English. And likewise, efficacy of a vaccine can be measured on how well it prevents an infection. Say, for example, if you pick up the virus, you're in company of virus-infected people. How far does a vaccine protect you from picking up an infection? That's not very good, in fact. But in terms of how sick you will get if you were to pick up the virus, and that's called efficacy against severe disease, and that's well over 95%, which is excellent. But that being said, the very vulnerable people, as you heard Dr. Dwivedi talk about the vulnerable segment, yes, they could get sick as well. So this means that vaccinated people should take maximum precautions, just like unvaccinated people. And that's an important message we need to give out to the community.
Right, and on this issue of immunity, another practice that we're seeing now is people getting themselves tested for antibodies, and they're taking that as a measure of immunity and worrying if they find their antibody levels dropping. What would you say to that?
It should not be done at all. No one should be checking antibodies routinely after their vaccination. In fact, the FDA from the United States has strongly recommended against testing for antibodies. Simply because if you check your antibodies, it's not going to tell you whether you're immune or not. If you're negative, the test is negative, it doesn't mean that you're not immune. So why test it?
All right, yeah, because that's something that's really worrying people. Now, if we talk about vaccines, people are also, wondering about the modern vaccines, as they call Pfizer and Moderna, and asking how do mRNA vaccines work?
Yes, all vaccines effectively work by stimulating our immune system in one way or the other. It's like different styles of messages to our immune system. So across the platform, there are so many varieties out there, and mRNA vaccines essentially send a code to generate the spike protein by our own cells. And when our cells generate the spike protein is picked up by our own immune system as though it is a foreign protein, like it doesn't belong to you. So it picks up the spike protein and manufactures antibodies and other immune cells against it. So that's pretty much how mRNA vaccines work. And the advantage largely is that you can produce a huge amount of mRNA vaccines at short notice compared to some other traditional platforms which actually depend on growing viruses. So it's like, how many viruses can you grow in your garden? So that actually limits some of the traditional virus platforms, but mRNA vaccines really have the advantage of ramping up production should there be any need. And the second advantage that mRNA vaccines have really is that you can tweak it if needed in the future. As of now, there is no indication yet that vaccines need to be tweaked, but clearly we need to be prepared should the need arise.
All right. Well, thank you so much, Dr. Jayadevan, for answering all those questions for us.
My pleasure.
Thank you.